Good morning. I am Professor Mrs. Beryl Mohanraj from Sri Shanmuga College of Nursing for Women. Today I will be taking class on needle stick injuries. It takes a team to eliminate sharp injuries. It is not an individual work. What is considered a needle stick injury? Needle stick injury, a penetrating stab wound from a needle or other sharp objects that may result in exposure to blood and other body fluids. The main concern is exposure to the blood or other body fluids of another person who may be carrying infectious diseases. So the occupational exposure is percutaneous injuries, example needle stick injury or other sharp injury. Splash injuries are nothing but it is contact with the mucous membrane, contact with non-intact skin, contact with intact skin when the duration is prolonged. What are the agents that are transmitted? Hepatitis B, hepatitis C virus and HIV virus. Risk of transmission is higher for HBV, that is 30%, hepatitis B virus, followed by hepatitis C virus, and HIV virus is 0.3%. What is the risk for HIV alone? Percutaneous is 0.3%, mucous membrane is 0.1%, non-intact skin is 0.1%. Who gets injured? Occupational groups of healthcare personnel exposed to blood and body fluids. So they can be clerical staff, administrative, dental staff, housekeeping staff, students, technicians and the nurses and physicians. So more time is spent by the nurses near the patient's bedside, so they are at risk. That is 43%, that is the maximum injured people are nurses. Where do sharp injuries occur? Patient room 39%, operating room 27%, outpatient 8%, emergency room 8%, laboratory 5% and other 30%. Where do sharp injuries occur? During use 41%, after use, before disposal 40%. When do sharp injuries occur? During use, after use and during and after disposal 15% and others is 4%. What devices are involved in sharp injuries? 6 devices account for 78% of all injuries. Disposable syringes 30%, suture needles 20%, winged steel needles 12%, intravenous catheter stillets 5%, phlebotomy needles 3% and scalpels 8%. Infectious specimens of NSI. So potentially infectious body fluids, blood genital secretion, semen vaginal secretions and other body fluids. CSF, synovial fluid, pleural fluid, peritoneal fluids account for these infectious specimens. The following are not considered potentially infectious unless visibly contaminated with blood, feces, nasal secretion, saliva, sputum, spit, tears, urine and vomitus. Factors that influence the risk of contracting an infection following a needle stick injury is type of needle, device visibly contaminated with blood, depth of injury, higher the depth, more the risk, volume of blood involved in exposure, viral load present in the blood at the time of exposure, timely performing the first aid. So how do we prevent needle stick injuries? Standard precautions must be followed. Work surface must be disinfected with 0.5% sodium hypochlorite. Healthcare workers must be immunized against hepatitis B vaccines. Spillage of blood and other body fluids must be promptly cleaned. Disposable needles should be used. Never recap needles and proper disposal after use. Precautions during handling needles. Recapping of the needle is wrong, a wrong method. Correct method is single hand scoop technique. Post exposure management. First aid has to be given. Steps of post exposure management. First is first aid. Report to designated nodal center. Take first dose of PPE for HIV. Testing for BBVs. Decision on PEP for HIV and HPV. Documentation and recording of exposure. Informed consent and counseling. Following up testing of healthcare workers. What are the do's and don'ts? So the first aid management do's is earliest is the first aid. Lesser is the chance of transmission of BBVs. For splash injury, irrigate thoroughly the site, eyes, mouth or other exposed area vigorously with water at least for 5 minutes. Spit fluid out immediately if gone into the mouth and rinse the mouth several times. If wearing contact lens, leave them in place while irrigating. Once the eye is cleaned, remove the contact lens and clean them in a normal manner. Don'ts are: do not panic, do not place the pricked finger in the mouth reflectively, do not squeeze blood from the wound, do not use antiseptics. Revised NACO guidelines for post-exposure prophylaxis. Source material: blood, body fluids and other potentially infectious material, or an instrument contaminated with any of these substances. Exposure code is EC, mild exposure. Mucous membrane, non-intact skin exposure with small volumes or less duration. EC2 is moderate exposure. Mucous membrane, non-intact skin with large volumes, splashes for several minutes or more duration, or percutaneous superficial exposure with needle or superficial scratch. EC3 is severe exposure, percutaneous exposure with large volume transfer by hollow needle, wide bore needle or deep puncture. Needle used in patient's artery or vein. Prevention and control. Dispose all the used needles and sharps in the appropriate containers. Be extra careful during emergent situations. Always use the exposure needles pointed down and away from yourself and others. Alert co-workers. when you have a needle or a sharp in your hand. Wear properly fitting personal protective equipment, gloves, eye protection, etc. Those who actually use needles and other sharp objects should be given additional training, including hands-on sessions in using products. Education of healthcare workers is critical in promoting a safe environment. What are the strategies to eliminate sharp injuries? Eliminate or reduce the use of needles and other sharps. Use devices with safety features to isolate sharps. Use safer practices to minimize risk for maintaining hazards. So our goal is preventing sharp injuries.